Hello guys, this is Brian here with the update video. Today is August the 9th, Tuesday, 2016, and here is some updates. Now, I don't know what's wrong with my webcam. It won't record sound. I checked the settings, did a system restore, still checked the settings, uninstalled, reinstalled it, and it still won't record the sound at all. I don't know why. Because I did make a video after I upgraded to Windows 10, so I don't know if that could be the problem. I don't know, or I'm going to have to buy a new one. I don't know what the hell's going on. It is a Logitech 9 Pro 9000, so if anyone knows why, please post them below and let me know. You know, like I said, I'm thinking I just have to buy a new one. So here are some updates, what's been going on around here. I did have my HMO panel hearing, and unfortunately it was denied based on it is exclusion on my policy. But yet they still are not referencing the right page or anything like that. But I do have 2 more appeal options. I do have a medical. I can do my last final medical review for medical necessity, and then I also have an independent review organization request, which I did that last Thursday. And the insurance company got it today. It was signed and everything. Now get this. When they sent me the paperwork for the HMO panel hearing, they sent me nearly, I would say, 400 pages of medical records and things like that. Most of it was duplicated. And the lady said, by law, whatever they have from the front cover to the end cover, they have to send me, even though it's duplicate, because this is what they review as well. And it was things like the doctor sent in and things like that. But I'm like, well, I don't have a paper shredder, and you know, I have one, but you know, it's not an industrial strength one. So guess what I did? Since I did an independent review organization request last Thursday or Friday, whenever I sent it in to them, I got a box and I stuck all that in there. So they're going to get all my medical records, duplicates of them at least, and let them shred them or let them do what they want to do with them. And by law, they do have to let me know within 20 days after receiving that. They have that time limit to make their mind up. So we shall see about that. I did go to the spine doctor. You know, like I told you, I was having shoulder pain and nerve pain going from the bottom of my arm into these 3 fingers. He said he doesn't seem to think there was a nerve problem in my neck, but he went ahead and ordered a new MRI of my neck and a new MRI. Oh, actually, a new MRI that he has done was my upper spine. He did the lower spine, but not the upper spine, and I got the results from that. And he left his practice, and I found out by his office manager, because I called him, he was not allowed to tell his patients where he's going, because he cannot solicit patients after he leaves the group practice. But anyways, they got my new HMO referral set up with the new doctor that's replacing him, which that's all good. Got the MRI done. I did call the new, you know, I called my old doctor's office up and asked them, well, because I found out where he moved. Oh, is he going to be taking the Blue Cross HMO? No. So, you know, too bad. I'm just going to stay where I go in the same office. You know, the doctor's, it's the same location. The new doctor's just taking his place. And they will have all my medical records because they belong to the practice. And, you know, the old doctor said, keep your appointment with the neurologist because they're the ones who can do the nerve test. Okay. So I went to have the nerve test done. It was painful. They found, let me go back and I scanned it here. They called it a bilateral ulnar nerve ULNAR, nerve compression neuropathy at the elbow, consistent with cubital tunnel syndrome. Which I think what they mean by cubicle, it's this area of the arm, not corporal tunnel. So that doctor gave me a medication called gabapentin to take, and that should help the nerve pain and numbness. And I think it has. I still have episodes of it, but it's getting better. No side effects like the other anticonvulsant medicines that they gave me, thankfully. But because I had that done on a Thursday, and on a Sunday I ended up in the emergency room because that nerve test was painful, and it really made my neck stiff, the muscles, and it was just stiff. And like for Saturday and Sunday, I had a migraine that just would not go away. And Sunday was really the worst. So, on Sunday, took all my muscle relaxers, took all my Tramadol, took all my migraine medicine, and nothing helped. I mean, it just would not budge. Plus, I was not able to move my neck at all after that day. So I went to the emergency room. They did give me a massive dose of Valium, morphine and Demerol, and also some Toradol to break up the migraine, which it did. I felt better afterwards. And Monday, I felt oozy because all those drugs, obviously. But I was able to move my neck. And I had to follow up with my pain management doctor, which I was going to postpone because I really didn't feel like going because kind of oozy. And they said it's going to be another. He's only here for every other week. I would have to wait the whole entire week. I was like, I might as well go now. And he said that after that nerve test, what I may have had was a muscle spasm in the neck was causing that. So he said, since I'm still having neck pain prior to that too, they're going to do a radiofrequency facet joint injection. I think it's like a nerve block, a mixture of a nerve block and a steroid injection, like a mixture of both, I think, the way I'm understanding it. I was supposed to have that done on July the 27th. Well, let me tell you what happened there. That Sunday or Monday, I was peeing out blood and had a lot of back pain. The emergency room visits were like 2 weeks apart. And so I thought I was passing a kidney stone. The back pain, burning of urination, and a little bit of blood. Kidney stone time. So my family member took me to the emergency room because I was really, really severely dehydrated because it was hurting to pee, and I felt really oozy, kind of pukish, sick, and didn't eat nothing all that day either, and had a low grade fever. So they did a CT scan and no stone, but they did give me little things of morphine to make me comfortable. And they did test my urine. It was a UTI with blood in it. They think I did have a kidney stone, and I did pass it. And I think the stone scratched the tubes from the bladder or from the kidney. Wherever one of the tubes, they think it's scratched. And once it's scratched and has blood, it became infected. That's what they call a UTI. And it causes bacteria and all that. And literally within a couple of days of taking Bactrim and the other pills that make you pee torn green and orange to and aseptic so it won't burn. The lady called me and confirmed my appointment for my procedure for July the 27th. And she called the day before, and she said, "Do you have a minute for me to review all your medications?" I said, "Yes, but I told her I was taking Bactrim and those 2 pills." She said, do you have an active infection? I said, yeah, I have a UTI. She said, since we're doing the neck, or if we're doing any kind of neck or back injections, we don't do any of those with patients with any kind of active infections. I'm like, why? I mean, the UTI infections is down there, not up here. You know what I'm saying? But I guess safer than sorry, I guess. So I'm finally having it done tomorrow, finally. So I'll let y'all know how I feel afterwards. I am going to be knocked out. Conscious sedation, you know, like what they use propofol for. Well, you know what Michael Jackson died of? He was using it just to sleep. I had propofol lots of different times. Is it when they do a scope down your mouth to look for ulcers? I had that when I had the C. diff. You know, they just inject it and you just fall asleep and you just wake up and talking. And they call it conscious sedation. Apparently, the doctor can talk to you and you can answer questions back. Apparently, I don't know. I don't know. I'm asleep. Because the other sedations I had when I had my neck injection in the back, which is the epidural injection, they don't use that. They use like a strong painkiller. I think I read on the discharge it was like Demerol. Get to the point of getting real extremely loopy and relaxed, but not almost sleepy, but not sleep. You know, just not complete sleep. But you can take a nap. I mean, the doctor will wake you up and ask you questions, but for those, hey, they require you to be fully awake for some odd reason. But this one, they don't. I don't know why. Anyways, when I did speak with this lady, when she did confirm all this, I said, y'all better make sure this is covered by my insurance company, because I checked with Blue Cross and they said there is a medical criteria, and I read it online, and it looks like I do meet the medical criteria, but you need to make sure I do, because, you know, they're the doctors, and you know, I can only read what parts I understand. She said, oh yeah, you don't know prior authorization required, nothing. I said, no, I'm not talking about prior authorization. I'm talking about the medical criteria. And supposedly she did call the insurance company. But I called the insurance company myself, and they didn't have any record of her calling, or maybe she did it online. Who knows? But guess what I'm going to do tomorrow? You ever sign those hospital forms that says you are the guarantor of the bill? You are financially responsible. Guess what I'm going to pull? She's going to BS me. I'm going to BS her back. I'm going to tell them to change the financial responsibility to the surgical coordinator's first and last name, their address, and telephone number if they don't pay the bill. The insurance company, I am. And I let y'all know if the hospital will say that. You know, if they will say if it's okay. I don't know if the person has to sign the form for me to change it. But that pisses me off to no end. But if it doesn't get paid, I'm not paying it. They don't have my social security number, so how are they going to ruin my credit? The hospital does not have my social security number. I never gave it to them. So tomorrow when I get back, I have to be there at 12:30, and the procedure's at 1:30. Of course, that's when when I get there, the doctor's at lunch, basically. So I'll let y'all know. I will try to make an update video. And please post below if y'all know why the webcam microphone is not working on the Logitech Pro 9000. Please let me know about that. And like I said, I will do an update video if I can, if I feel well enough afterwards. So wish me luck. It's just an outpatient procedure. Should be there less than 2 hours or 3 hours. So I will talk to y'all later. Adios.